All right, hello and welcome to this Tuesday, May 19th, Eureka City Council meeting. We're so glad you're here. It's lovely, as I was telling someone out in the audience, to have such a full house. So welcome, welcome. And we will open this meeting with the land acknowledgement. The land that Eureka rests on is known in the Wiyot language as Chirujiji. Past actions by local, state, and federal governments remove the Wiyot and other indigenous peoples from the land and threaten to destroy their cultural practices. The city of Eureka acknowledged the Wiyot community, their elders both past and present, as well as future generations. This acknowledgement demonstrates the city's commitment to dismantle the ongoing legacies of settler colonialism. And could we get a roll call, please?
Councilmember Castellano.
Here.
Councilmember Moulton.
Here.
Councilmember Fernandez.
Here.
Councilmember Bauer.
Here.
Councilmember Contreras-Deloche.
Here.
And Mayor Burgell.
Here. And would all who care to join me in the Pledge of Allegiance? I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, and was there a report out of closed session, Attorney Black?
No final actions were taken in closed session, Mayor.
Great, thank you. And with that, we will begin with our first proclamation for Public Works Week with Councilmember Castellano. If you all want to come forward, whoever's receiving this award or proclamation. That's awesome.
Great. Thank you all for being here. Thank you for your service to the people of Eureka. This is the City of Eureka proclamation in recognition of Public Works Week, May 17th through 23rd, 2026, rooted in service, powered by community. Whereas public works professionals focus on infrastructure and services that are of vital importance to sustainable and resilient communities and to the public health, high quality of life, and well-being of the people of the City of Eureka, and whereas these infrastructure and services could not be provided without the dedicated efforts of public works professionals, who are managers, engineers, and employees at all levels of the organization, who are responsible for rebuilding, improving, and protecting our city's roadways, storm drains, water supply, water treatment, and sewer collection, sewer treatment, and other services essential for our citizens, and who also serve as first responders in times of emergency, providing critical support for community special events, address and remediate illegal dumping to protect public health and the environment, and manage and maintain the City of Eureka's fleet to ensure reliable and efficient operations. And whereas it is in the public interest for the citizens, civic leaders, and children in the City of Eureka to gain knowledge of and to maintain an ongoing interest and understanding of the importance of public works and public works programs in their respective communities. And whereas the year 2026 marks the 66th annual National Public Works Week sponsored by the American Public Works Association. Now, therefore, I, Councilmember Castellano, on behalf of Mayor Kim Burgell and the City of Eureka, do hereby designate the week of May 17th through 23rd, 2026 as Public Works Week in the City of Eureka. I urge all citizens to join with representatives of the American Public Works Association and government agencies in activities, events, and ceremonies designed to pay tribute to our public works professionals, engineers, managers, and employees, and to recognize the substantial contributions they make to protecting our health, safety, and quality of life.
Thank you, Mayor. Thank you, members of the council, for this proclamation and recognition. I'm truly pleased to accept this award on behalf of the Public Works Department. This recognition reflects the hard work, dedication, collaboration of many people within the Public Works Department. I am grateful to work alongside such commitment colleagues who care deeply about improving and strengthening our community. It is a privilege to serve the city. We appreciate the continued support and encouragement. Thank you again.
on. Tall in the back, short in the front. Hang out.
Thank you all for being here. And this takes us to mayor's announcements. And today we have the privilege and honor of inviting up TAY, their Youth Advocacy Board, to tell us what's going on with them. Come on up. Welcome.
Hello, everybody. My name is Jess Weaver. I've been a part of the Youth Advocacy Board for about 2 years. Pronouns are she, her.
Hi, everybody. Thank you for having us. My name is David. I'm also a YAB member.
And so I'm sure a few of you are already pretty well versed on what HCTAC is, but I'm just going to give another elevator speech. So HCTAC really focuses on using and empowering the lived experience of young people in Humboldt County. It's a subdivision of Humboldt County Department of Health and Human Services. It provides opportunities and services for young people aged 16 to 26. There's a lot of psychiatric services included, like therapy, first episode support. We also have case management, drop-in spaces, and workshops. And then, my bad, opportunity mainly lies in networking, our ability to help with referrals, and also the Youth Advocacy Board. Personally, one of the opportunities that I've had through my work with the YAB is being voted in, I guess, as the youth chair, as one of the youth chair members for the Humboldt County Behavioral Health Board. And then also I have had the opportunity of being at the Capitol building and being able to present my words there through the help of the YAB. And now David has
Some more specifics about what we're up to recently. Thank you, Jess.
Yes.
Some of the things that we've done recently include a visioning event, a World Cafe workshop. And I personally was not present at the service provider / general community World Cafe event, but I want to give a shout out to Renee. Thank you so much for attending that event. Your input is very valuable. We really appreciate you being there. It helps us inform our next steps going forward as a YAB and as HCTAC as a whole. Another event that occurred recently that the YAB attended was the Children's Mental Health Conference, CMACE, which is very important because youth with lived experience, it's valuable that they share their stories and attend these workshops and conferences where they can learn how to show up to service provider spaces and with the knowledge that service providers have as well, so that they can support themselves in those moments that are oftentimes youth do not have support in. So moving on to what we're doing now, just today, I personally facilitated a workshop, mental and behavioral health workshop. Specifically, it was for youth who are interested in Dungeons and Dragons, character creation, specifically an empowering method to create a character that can help someone navigate some mental health challenges. We are in the process, among other things, of starting some new youth-led collaborations, one of which we are hoping to and planning to start an informational campaign with the schools around the county, and where we can share youth voice and connect young folks to community resources, because outreach is so desperately needed in Humboldt County. So one thing that's coming up soon, or a couple things, will be the pop-up gallery where young people will be presenting their stories, their lived experience through the medium of photography and street art. And that will be on, what was the date for that? That will be Friday, June 26th from 2 to 5 p.m. at the Schluter Gallery downtown in Eureka. And I will pass it back to Jess.
Thank you so much. So, yeah, those were kind of some of the practical ways that we implement our values. And where we hope to go from here, I, again, stuck to a more value-based side of things because, as we know, things are turbulent. But what we hope to do is we hope to continue to break down societal and systemic barriers and stigmas. We hope to further our advocacy as young people and show up to more important decision-making areas. We hope to acquire new voices throughout the passing of time, as there will be new young people, surely, with new things to say. We hope to continue our integration across the county as a whole, and we hope to provide more consistent and relevant support to youth across Humboldt County. And like David mentioned with the World Cafe, that is just one of the ways we do that through information gathering. So, with all that being said, I would like to just take a quick minute to discuss things that I figured out would be effective in supporting the work that we do. Accepting feedback and actively looking for ways to engage with our youth advocates is insanely valuable, especially because since we are one group trying to split ourselves many different ways is difficult. It's easier if people actively look to come and listen to what we have to say. Incorporating our unique support system into important, meaningful, and actionable spaces like we already have established with the Behavioral Health Board. We hope to continue to show up in important spaces all the time.
Thank you very much.
Thank you so much. And I'm curious, are there any questions from council?
Sorry about that.
I know
Councilmember Moulton?
Hi there. I want to thank you for the presentation and for all the work you do. Peer support is so incredibly important. Like knowing that coming up with a D&D character is a great way to like get people to comfortably discuss things that, you know, might be difficult to discuss is that kind of intuition, and just knowing that is something that you only know when you're dealing with your peers. I engaged with a Minecraft-based mental health program for children. It's kind of the same thing, just like, you know, get people feeling comfortable so that they can do the work they need to do without having like stigma. So I'm grateful for your perspective, and I'm grateful for your work. Thank you for being there.
Thank you very much.
Councilmember Fernandez and then Castellano?
I'm grateful for all the work that you do too, but I want to hear more about Dungeons and Dragons. Tell me.
It's first and foremost, it's storytelling, and storytelling is in many ways it can be extremely empowering, which is one of the reasons why I designed this workshop, and I think. In addition to storytelling, collaborative storytelling, it's a space where people can just hang out, have fun, and build community, especially for more introverted youth. I think it's a very safe space. Right? It has a lot of potential to be a very safe space. Part of the workshop was learning to lay the foundation for the D&D to be a safe and inclusive space for folks. But yeah, that's my spiel about that. Thank you.
Thank you.
I'm 100% in agreement with you, and that's why I wanted to hear your take on it. And I'm curious, was this workshop the first time you had done it, or have you done previous sessions?
Today was the first workshop that I have ever done for TAE or in general. But yeah, it was the first. Yes.
and then I know it's tangential. You were talking about being more involved with the K through 12 schools, and so
Yes.
do you plan on? You had just done this workshop. Do you plan on piloting that at all with any of the students in the K through 12 system, or?
I hadn't considered it until now. Mostly, it is a matter of capacity. Unfortunately,
I'm with you on that.
Oh,
And
yes.
that's why I wanted to
Yes.
ask you about it, because I've been very curious about that myself for the last probably decade or so. You're talking to someone who's been playing since second edition. So
Gotcha. Okay.
yeah.
Veteran.
Yeah.
Gotcha. That sounds like an excellent idea, and I will very seriously consider that. Thank you.
Okay. And then just, maybe a few technical questions. I'm curious, getting away from D&D for a moment. What are the challenges you're looking at in your organization? How is funding going at the moment?
Yes. So recently, I helped give a presentation to DHHS on this very topic. The main thing that we're facing is budget cuts, unfortunately, and staffing shortages. Right now, we currently have 2 peer coaches for a lot of clients, way too many. For an individual caseworker or peer coach to handle. So we are strained financially, and our staff are also very strained and stretched thin. The YAB has also faced some challenges recently. However, we're overcoming these by reaching out to community spaces like these, and DHHS, and hopefully the Board of Supervisors, to communicate our needs and how important it is to support the youth of Humboldt County, especially in these very uncertain economic times and times in general. So, yeah.
Thank you.
Councilmember Castellano.
Firstly, thank you for being here and for your leadership in the community. I'm curious, as someone who during the day is engaged with a youth program, do you find many opportunities for cross-pollination with other youth programs, or how might you imagine something like that taking place?
Yeah, so historically, the HCTAC and the Youth Advocacy Board have done collaborations with other youth-serving organizations. One good example of this, something I attended was and was a part of, was the what was it? It was the conference for service providers. I'm forgetting the name of it. What was it? I forget what it's called. It wasn't either of those, but we
It's okay.
partnered with Two Feathers, and we hosted a panel where we talked about our lived experience and gave some possible solutions to common issues that service providers face. So that's one example. Hosting panels, doing outreach, like shared, like collaborative outreach, sharing resources and things like that. Those are the 2 I have off the top of my head. Is there anything you want to add, Jess, about collaborating with other youth-serving organizations?
So thankfully, due to Humboldt being a pretty tight-knit community, lots of service providers are aware of the other things that our community has. But one specific thing that we are working on actively is we are meeting with, as the Youth Advocacy Board, we have a group of people dedicated to implementing the Youth Homelessness Demonstration Project Grant, and that is going to create lots of opportunities for people that need supportive housing to get supportive housing. And one of the ways we're doing that is by meeting with the RCAA and the good people over there who are going to help us through the implementation as the service provider. They are going to be building the housing, and we're waiting currently to be able to meet with them from the Youth Service Bureau specifically, correct?
Yes.
Yeah, so that's my 2 cents for right now.
Yes, the Youth Homelessness Demonstration Project is a really crucial grant that has come up. It's a federal grant. And we are currently giving our input on some new contract stipulations, which we have some serious concerns about. But yeah, we're still working on that and improving it. And yes, working with YSB and RCAA very closely on that. But yeah, those are a few examples.
Thank you. And this is maybe just a comment for our city manager. I'm just curious. It seems like there might be some opportunities for follow-up related to the housing programs that the city of Eureka is doing.
Yeah, with the ASICS grants and some of the other grants that we have with the developments that we have now, we can definitely do that.
Mm-hmm. Yeah. Maybe we'll try to follow up with y'all with some of the things that we're working on with the city.
Okay, awesome. Thank you so much.
Is there anything further?
We can email you guys. That's how it works.
Did you have something else? Councilmember Fernandez?
Yeah, I just want to know more about D&D.
On from that, any
I want to
other
know what your
comments?
thoughts are on Critical Role.
Councilmember Contreras-Deloge?
I was just going to say thank you. I appreciate you guys coming. And I told Amy this today, but I want to just tell you guys just that how motivated and how driven all of you guys are and the things that you're doing really gives me a lot of hope. I love seeing the different programs that youth are involved in. And I think we have a really bright future because of the type of youth that are coming up. So I just wanted to tell you guys thank you.
Thank you very much.
Anything else? I just want to thank you so much for the presentation. And I really believe that our community and that there is a lot of hope and that our future is really bright. And you guys are a beautiful example of that. So thank you so much for your leadership. And thank you, Councilmember Castellano, for bringing that housing business forward, because that's going to be an excellent partnership or at least discussion moving forward. So again, thank you and stay in touch.
Thank you. We could use all the hope we can get.
Okay. All right, and then I just have a couple more announcements. For our Board of Appeals Committee, we are still looking for 2 people. So if you want to get involved in the city, we'd love to have you. Few things happening in the city. Friday night markets start this coming Friday. Friday night markets. I believe the theme is the Kinetics theme, which is amazing. And then, of course, the Kinetic Grand Championship is happening, starts Saturday morning at noon and moves on through Arcata, the Triathlon of Arts, just fabulousness. Forest Moon Festival begins May 30th. And lastly, and not as fun, we will be having a special budget meeting at 5 p.m. next Tuesday, the 26th. It could be fun. So those are just a few things coming up and happening in the city. And with that, we will move on to public comment. Oh, no, we won't. We're going to move on to presentations with EPD and their homeless survey. Commander LaFrance? And Managing Mental Health Clinician Rosen and Mr. Ross. Sergeant Ross. Welcome, you guys.
All right, good afternoon or good morning or good night. You have 3 options depending on when you're working. All right, so that every 2 years we do the homeless survey for the city of Eureka. This is different from the point in time count, which is done by the county, but we present this every 2 years. So when we run this survey, what's unique about this is a 4-week survey. We always do a 4-week sample starting the first week of March and ending in the first week of April. So it's 4 straight weeks. And I'll give you some historical stuff in the next slide here. Personnel involved in this are CSET officers, CARE, so clinicians, case managers, and then Uplift Eureka. A bunch of their staff are involved in this as well. But for those 4 weeks, the primary focus for those teams is to go out and get as many surveys as possible. And we use SurveyMonkey because 1, it's easy, and 2, because it's easy to use. So and we can get data pretty easily off of that without having too much of a clunky system. We have 40 questions in our survey now. We actually added 2 more. We've really been pushing the threshold of too many questions. But every single year, we're like, man, we need more information. I know a couple of years ago, we wanted to add like the 10 ACEs questions, but it's like, we can't do 50 questions. So we've really we've trying to streamline it down, but sometimes we just ask questions because we have to, or they piggyback on other questions. But we have 40, we have 2 new ones. I'll share those with you. All responses are self-reported. So even if we ask a question about someone having, have you been treated for or diagnosed with a mental health disorder, if we know they have because of the work we do, and they say no, we still report it as no. So there is a margin of error in this because it is self-reported. This presentation is just going to highlight the data. We're not going to show you all the data. I actually had a 63-page raw data packet I meant to bring with me, but as I was leaving headquarters, we ended up chasing after a wanted felon that we all went to, and so I unfortunately forgot that packet, but I can probably provide it to city manager to hand out later. So, but this is just a highlight of the data. It's not all inclusive, so don't start adding the numbers up and saying it's not 100. I know that. It's just the highlights. It'll be a comment somewhere. It's not 100. We know. All right, since 2018, we've been doing this. So 2018, initially, it was done under Chief Watson. That's when CSET first started in July of 2018. And that time we had we've been through a couple different missed officers. Is missed officer Wayne Urbang at the time, who's now Commander Urbang, and we had it was about a month-long 4-week sample through the month of October in 2018. And at that point, if you look at COE, that's City of Eureka, and then it's PIT is the point in time count. So I just want to do some comparisons real quick. So 2018, we did 190 surveys. We always hear these grandiose ideas that we have thousands of homeless here. Based on our numbers, we know that's not true. Based on our experience, we know that's not true. 2019, we didn't do the survey because we do it every 2 years. The point in time count was 653 for Eureka. 2020, we did the survey from same first week in March to first week in April. We did 205 surveys. 2022, same time frame, 249. The PIT count said 498. So a giant difference in those numbers. What's important to know is the PIT count has a correlation to getting money from the government. Our homeless survey has nothing to do with. There's no money connected to it. So 2024, same thing, same sample size, 221 for our survey. PIT count was 323, and then this year we did 239 individual surveys. And I tried researching we did the PIT count this year. If you don't know, the PIT count is one day. One morning they go around and there's a whole system I won't go into, but I'm not a fan of it. But they just get a general guesstimation of how many homeless are in our community. I couldn't find the number what they hit this year. I believe it dropped by 15% from last year. So, but I didn't get an exact number, so I did not have that to share. So it's a giant question mark. All right, we'll jump into this. So our first question is it's always going to be their name. I'm not going to show their names to you. It's just not polite or the right thing to do. Only a few of us have access to the raw data. Actually, all the data. Only I think 2 or 3 of us, myself, and then Jacob, and also his admin tech as we go through the data. So we always ask the age. This is pretty consistent across the board. We usually see the peaks around 40 to 44 years old. So throughout this, as long as I did it right, the gold bar throughout this entire presentation will be for 2026, and the light blue will be 2024. So this is one of the first years that we actually saw someone under 18. We saw one person under 18. I'm not sure who the person was. This year I actually didn't do any surveys first year. I just collect the data now. But we one person under 18. Otherwise, we're looking really a big range of 35 to 49. But then we saw some peaks also with 65 to 69 and actually 70 to 74. So we saw some jumps in those. Not sure why. We could probably dig in deeper and look at why that happened, but that's the numbers we had for this year. Gender, this has been across the board since 2018. It's usually anywhere between about 2/3 to 70% male, and then the rest are female. And so that's consistent across the board. Across the country, if you're a male, you're much more likely to be homeless than a female. That's just the facts based on the data. Race or ethnicity, again, for us in Humboldt County, white is a predominant race here. So again, we saw 79%. The Native American, Alaska Native, these are, when we ask the question, and if people say I'm Native American, we put Native American down. Doesn't mean they have to be technically affiliated or have to have whatever in the books. They say it, we respond to it. So the one issue we have with this number is that I believe our population in Humboldt is about 6.6% Native American. So that's more than almost triple that number if this is actually accurate. And so within the survey, we also record what tribe they are with. And from this, we can also talk to our tribal partners and say, hey, we have some of your community members within Eureka. How can you help us help them? Household, family, or relationship status. Most people are single. This is pretty steady across the board. Apparently, the long-term relationships, that's some breakups. So that dropped down a little bit by about 4%. And we probably had a couple more marriages. So, but again, across the board is commonly single. Who do you live with? Most people live alone. We saw a pretty good decline in about 4% in having pets. I'm not sure. I'm sure Sergeant Ross can answer that question later if they're seeing more animals out there. But data-wise, we're seeing less pets. And then when you look at children, that's going to be adult children, not children. If there's little kids on the street, that's something that luckily our mental health officer, Jamie Clark, addresses very, very quickly with our other services. And if we find a small child, they are not out there for many more minutes. Education we always look at. So biggest right now is 28%. We had high school or GED, followed by some high school, then some college. Someone had a doctorate. They reported that. And then we have a couple bachelors and some associates. But again, this is just looking at it. The trend continues to be steady across the board. Monthly income, biggest one is 0, which has been consistent since 2018. We do have some folks that obviously make a fair amount of money, over 3,000. And again, this is self-reported, so it's possible. I've known a gentleman years ago that would easily have 5,000 cash on him all the time. He just store it, had some various mental health issues, didn't want to be inside, and he just stores money. So, but again, if you look at the numbers, I can't remember the average rent right now in Humboldt County, but it's probably around $1,500. So most folks that are on the street, if they did want to be inside, they could not afford to be inside. Last time employment, 1 to 2 years is the peak here again at 20%. And the less than 1 year actually dropped almost by half, down to 12%. And if you see the number on the bottom left there, it says 15S. That's how many people skip the question. So just understand, again, there's always, with any kind of surveys, there's always going to be some form of error. But 15 people skip that survey out of 239. Military service, we hear this a lot. There's lots of vets in the street that are veterans that aren't being served. This is not true in Eureka. Most people that we encounter that are within our homeless community are not veterans. If they are veterans, they are usually fairly swept up quickly to get services. I see a lot of signs flying around town like I'm a veteran. Of course, we contact them, we talk to them. We actually find out they actually either don't qualify or they're not a veteran. But if they are a veteran, we are pretty good about getting those services to them, or the VA or the other entities. Nations First usually picks them up pretty quickly to assist them. Where did you sleep last night? This is a giant drop for shelters across the board. Shelter includes the Mission Family Shelter and Betty's Blue Angel Village. So we dropped from about 46% to 26%. It's a pretty big drop, and I'm not sure why. It's possible Sergeant Ross can share some insight on that. I don't have that, but we're just seeing the drop. Same with Encampment or Greenbelt. We saw a drop there also, but yet we're seeing an increase in street, alleyway, and doorways. And again, there's a lot more places that we have. There's a long list of places where people slept the night before. We just didn't share all of them. We shared the top 5. How long have you been homeless for? So right now our biggest is 3 to 5 years, followed by 1 to 2 years, and then less than 1 year and 6 to 10 years. We have some folks that have been more than 20 years. We do know that the Crowley property, whatever the new name is now, Sunset, okay. A lot of the Bayside, okay. There's too many names. We know a lot of the folks that have been on the streets for even, I think, 130 years, it was housed down there, so, which is 36, that's a long time. So we know that number would drop a little bit, but again, these are, again, fairly steady with some movement, but nothing too drastic. How long have you lived in Humboldt for? So it's about a quarter of our folks have actually been born and raised here. We always hear stories about people being bussed in from San Fran nonstop and other areas. Not saying it doesn't happen, but for the most part, that's not true. More than 41% have been here 20 plus years. So either born and raised or they've just stayed here. The total is 41%. So a lot of our folks have been here for a long time. Why'd you come to Eureka? Biggest one is family, friends, relationships. Recently, this is a new one for us, is Better Life. Resources actually popped up to number 3 this year. It was not there before. And then employment and then marijuana showed its face again at number 5. Again, there's many, many other reasons why, but these are the reasons from this 2026 survey. Where'd you live prior to becoming homeless? Again, most are from Eureka. And then we saw a tie with other California counties, and other states. So when I was going through and looking at the data, various states from South Dakota to Oklahoma to, I think, Mississippi to all over the place. And somehow they landed here in Eureka, California. Why are you homeless? This is always a fascinating question. Again, with this type of question, they can actually answer more than one response. So they can say, hey, I had a family, I got evicted, and I'm using alcohol and drugs. I just can't stay housed because of my addiction issues. And so there can be multiple things. But the biggest one is family. The evictions actually popped up this year. Employment's number 3. Affordable housing popped up also. Alcohol and drugs is usually 10 to 15%, which is pretty steady, and we'll see why in a little bit. And then personal choice is 9%. That's a factor we'll talk about in a little bit. What we do find with a lot of our folks that this is a personal choice is we'll see the same people from 2018 all the way to 2026, which is a little less than half my career here at EPD. Periods of how many times they've been homeless in their life. So most people have had one set of homelessness. So they just became homeless. They've been there nonstop. They've not been inside at all. Other people have been homeless. They were housed or gotten some type of facility or organization or in a shelter, live-in shelter, and then came back out, back and forth. But 31% one time, and then 13% for 6 or more. So that's a lot of jumping back in and out of housing, which can be challenging, especially after so many times. Why do you want to back inside if you keep losing housing for some reason? Satisfied with your current life? This is a question we've asked since 2018. Are you satisfied? Majority is no, 60%. Yes, about 20%, and then neither, about 10% or 12% for this one. And those have been pretty steady across the board since 2018. I would have put all the data from every year on here, but it'd be so small we couldn't see it. So, but if you do want it, I can. It's located, I believe, on our website, and if you Google or look up anywhere online for Eureka Homeless Survey, you'll find it. Is your lifestyle a matter of choice? This is, again, consistent. We're usually around 30%. We've seen up to 2/3. So 30% say, this is my choice, I'm doing this. And then I put this in here, 7% actually refuse to answer this question. We actually have this as not a common answer, but people refuse to answer a question, and then incomprehensible or nonsensical. So we say, is a lifestyle matter of choice? The moon is blue, right? That'd be a nonsensical response to the question. And so we saw 4% there, but again, about 30% or 2/3 often say it is a lifestyle of choice, which obviously makes it challenging when you're trying to assist them in improving their lives and the community, and lessen the negative impact that often people have in this environment on the community and themselves. Physical disabilities or chronic health problems. This has been staying strong around 50%. So it's 48 this year, self-reported, but it's usually around 50%. So half the population have a chronic health problem or a physical disability, which is challenging because healthcare in the community, even though it's getting better, the hospital's doing a good job on many fronts, but it's still challenging. Diagnosed or treated for mental illness or mental health issue. So about 47% self-report a yes, 8% refused, and about 3% had a nonsensical response. So in theory, if you take those other numbers, we usually sit around 50%. My opinion, based on my experience being out in the field, is probably around 70%. And I'm sure Jacob can explain more on that. But again, self-reporting, about 50% across the board. Where do you usually go when you're sick or injured? St. Joe's is the #1 spot. Mobile Medical, which is usually located down at Freemill, or over at the Blue Angel Village, I think on Wednesdays. It's a common spot. Open Door Clinic has definitely increased. 11% going nowhere for medical or issues or when they're sick or injured, which is not good. Because when they do go to the hospital, it's usually pretty traumatic. Or their injuries so much or they're so sick, it's going to be costly for them and they're going to be there for a while. And then urgent care at 9%, which is an increase from 2 years ago. Visited the ER in the past 12 months. About a little more than 2/3 didn't visit the ER at all. And then about a quarter visited one time, and it went down from there. Health insurance, Medi-Cal obviously is the top one here at 49%, and partnership increased to 42%. About 5% have none. We saw others with VA, UHIS, very like 1%, very, very low numbers, or even less than 1%. But the predominant one is Medi-Cal, Medicare, and partnership, which should be expected. This is a new question for us. Times arrested or in jail in the past 12 months. So about more than half said 0, and then one time 20%, 2 times about 9%, and so on. So it's a new question we threw in there just to see where we're at. Again, we could dig in our databases, which is not, it'd be way too much. We probably couldn't dig in the databases because it'd be really, really challenging to do that with our system. But again, we know a lot, or not a lot, but a fair amount of our folks we engage with on the street, they will end up in jail at some point, or they're on probation or parole. But we just want to get a general idea of what percent are actually going to jail or not. Drugs or alcohol have been a problem in your life. So we have a couple of questions about drugs and alcohol. You'll see it. We'll actually dive into daily or use, how much they're using, but we do some other analysis on this. Based on the analysis, about 56% of our population of homeless community say drugs or alcohol have been a problem in their life. So more than half. My opinion is probably a little higher based on some other data we have. I think it's more around 70%. But again, the data from self-reported is about 56%. Drugs and alcohol been a problem in your life? Again, we actually break it down to actually these drugs. We talk about meth, alcohol, fentanyl, marijuana, heroin, prescription medication, and cocaine and crack. We'll break down those even further, but that's where we sit right now. Methamphetamine is always king in this town. Usually for females, when we break down the data, females, the number one drug of choice is meth, and for males, it's alcohol. That's historical across the board. And we can talk about that more if you want.
Commander, so the 21S at the bottom are people that skipped.
Skip the question, yes.
So those, on every one, there's been skips.
Correct, yep.
Okay, thank you.
So we're looking at alcohol use. So a little more than half say they never use alcohol. About 10% or 9% say they use it daily. 20% on occasion, and then the others from there. And 7% refuse, and 19 skipped this question. So methamphetamine, about 21% say they use it daily, 7% weekly, 3% monthly, and 11% on occasion. A little less than half said never, and 9 refused the question. And every year we get refusals. It is interesting that you'll see our officers talking to people. And again, most of our CSET, they know the people out there. I mean, they're pretty much their extended family because they see them every single day, and it's a unique relationship. But they're pretty honest about their use. I mean, we know they're using. They know we care about them. We also know that we want to get them in treatment if they want to go, et cetera. And so it's unique to see these surveys actually go hand in hand when someone tells, I use meth daily. Heroin use, I thought I'd see a more drop in this because I honestly haven't seen heroin in a couple of years. We don't see it that often anymore. But 80% say never use heroin, and then these have dropped. These have been dropping because fentanyl's cheaper, it's easier, it's getting in the country, and it's cheap. So 13% say it's daily, 7% on occasion. 67% say it's never use it, 8% refuse. My guess is it's still higher than 13% daily because of stigma associated now with fentanyl. Used to be the stigma with heroin that you could use meth all day but don't use heroin. There's stigma, and now the stigma is really associated with fentanyl because I don't have the numbers on ODs, but for a while we were running a lot of ODs and using a lot of Narcan and multiple doses of Narcan. Marijuana, of course, Humboldt County. So about 2/3 are saying they use it daily, 8% weekly, 15% on occasion, and 35% said never. This is a new question for us. Have you tried to get clean on your own? If so, how many times? 40% said yes, I tried to get clean 1 to 5 times. 5% 6 to 10 times. Almost 10% refused the question, and about 36% said no, they've never tried to get clean. They've been treated for alcohol or drug abuse, so we just asked that. Again, 49% says no, yes, 1 to 5 times at 33%, and then 10% refused that question as well. But we have seen a couple that 20 plus more times actually going to a treatment facility. How do you financially support yourself? So the biggest one, again, I know actually it dropped from, it went up to the top as SSI, SSDI, or SSA. So 23% odd jobs actually rose up this year. Public assistance actually dropped. I don't dropped also. And then recycling apparently went up by 7%. Do you receive any of the following public assistance? Food stamps is always number one, 69%. And then I think it's pretty steady with the others. SSI, General Relief, Social Security Disability, and Cal State Disability, and then none. What prevents you from using assistance? So we ask these questions. We want insight to why this is happening. Why, if you're not using assistance, why don't you actually get it? The number one was nothing. Nothing prevents me from getting it. So about 30%. Nothing prevents me from using public assistance. So 8% lack of knowledge or how to apply. Lack of transportation is running third, 7%. I don't know, 7%. And then lack of knowledge of programs, 7%. Those are actually pretty good numbers. They're all less than 10%. I know one of the focuses with Uplift is really making sure people know how to get places, how to apply for jobs. You look at Pathway to Payday, these programs that we have that are effective. If I did a historical on these, I think they're a little bit higher with the lack of knowledge. But again, our numbers are pretty low, in my opinion, because the programs we have and that they're very, very active in getting people employed and helping them get employed. Resources used. The number one spot in Eureka is still free meal at 60%. Again, we track every month I get numbers from them, how many meals they serve. Against meals, not people. but Free Meal has always been the king of resources here in Eureka. That's why for us, for EPD, for Uplift, for CARE being down there at Free Meal is beyond important to embed with that community, be part of the staff, work with the staff, work with the clients down there, help serve food, have the barbecue every year we have the service fair. But it's really important to do targeted outreach down there with folks. The mission's number 2 at 41%, Food for People, Open Door at 26%, and then Betty's at 23%, staying strong. What do you need? This pops back and forth quite a bit. Bathrooms, 37%. This has always been, not always, it was 15% last time, but 37%. It's a pretty good incline this year, increase, double. That's been an issue, and it's a challenging thing to deal with. But again, that's something that we've looked at in the past, and that's a constant need that we're hearing. Laundry is interesting. Providence, the resource center down at Free Meal, run by Brian, the resource guy, great guy. But they lost Providence lost some funding for laundry services, and so that's one gap that eventually I'm hoping someone will fill if there's funding found. And he would give out laundry cards for people to wash their clothes. And so we've talked about mobile laundry services. We've brainstormed for years on this, different things, but that was a big hit to the community when the laundry service stopped. Place to live, that's commonly up there. Having more money, that's throw me in there too. And then hygiene as well, and showers at 22%, which is interesting because we actually have showers down at Free Meal, and then we also have AHA as well. But again, we definitely can use more showers. So. Almost there. Biggest barrier for getting housing is lack of affordable housing, income, employment, upfront cost, and lack of rental history. Again, I think our programs have been addressing that on various ends, but obviously more needs to happen. And last but not least, the biggest barrier for obtaining employment, housing is the biggest one, 17%. Disabilities or health issues actually dropped to 15%, but still is number 2. Transportation, number 3, is still at 14. Appearance, clean clothing, and hygiene. That I'm sure is playing in also to the laundry service. And then mental health issues, which actually dropped, but it still will remain number 5 for us. And these guys are here to answer any questions for you as well.
So do we have any questions? Councilmember Castellano?
Yeah, just one quick question. Thank you for the report. It's always interesting, it's not the greatest word. Share some insight into what the needs are. I was curious, the decrease in the treatment for drugs and alcohol. Have you seen any correlation between that and just the number of spaces available or programs available for treatment?
So we used to use Waterfront Recovery, and they would take people. We could take them there just at a drop of a hat. A lot of places are wanting appointments now, which are really difficult. A lot of times you get somebody having a bad day, you start talking to them about rehab, and you have somewhere to take them. Right now we don't have that. It's like, okay, now it's next Tuesday. Well, from this Tuesday to next Tuesday, 1,000 things happen. Mm-hmm. And so we try to find them. We try really hard. That's been something that's pretty tough. Waterfront's still great. It's just a little bit slower getting people in than it used to be. And we don't have really any other option than that.
Okay.
Yeah, historically, when CSET first started, we had Measure D funding as well and support with the county. So we could easily drop off that day for Waterfront. That's why when I think years ago we showed our presentation for CSET numbers was like 250 referrals in a couple of years. I mean, we would call them when Sergeant Swanson was a missed officer and Sergeant Ross was the old 10 officer and ranger. We would find someone. We have that 5-10 minute window, 15-minute window. They want to get treatment, right? You're going to lose them after that, and so we can direct line of service right to the location, and then they would get in that day or at least get that started. But now it's a limitation, and part of it is how the insurance works and some other things. But it was a lot more streamlined back in 2018, 19, 20 than it is in 2026. But it was nice to drop people off.
Yeah. So part of that was related to the implementation of the drug Medi-Cal system that Humboldt participates in, where we're effectively sharing beds across 6 or 7 counties. I'm full disclosure, I'm on the board at Waterfront, and there has been an issue with retaining providers and being able to staff up the number of physicians effectively and nursing staff to be able to accommodate full patient capacity. So usually their rehab is full. However, their detox is usually not able to actually meet its bed capacity simply because of staff limitations and the staffing ratios required. And that really kind of harks back to the typical issues we have here in Humboldt of retaining physicians locally.
Yeah, thank you. Do you think, I know, there's some new programs being developed, that are kind of mental health programs. Do you think once those will open, it will help that situation?
I do, particularly the expansion for Crossroads that Wes Harrison is working on, being able to add a significant amount more beds for rehab will be super, super helpful to the community. That said, in talking with both Waterfront and Crossroads, we don't anticipate that to still exceed demand. I think this is a situation where we are chasing a moving target. And we will expand, and that will help more people, but we will not help all the people with the expansion.
Yeah, thank you.
Councilmember Contreras-Deloach.
Yeah, hi, thank you. I was curious, the one slide, one of the questions that was asked was lifestyle choice as a reason for being on the streets. And I was curious how with, I think it was maybe 3 slides before that, there was a list and it included mental health, escaping abuse. There was kind of, I think maybe 6 or 7 different categories. And I was wondering how you squared those 2 things together, because I was wondering if lifestyle and choice could include people who, chose to escape abuse. I just was trying to square those 2 different slides.
Yeah, it's going to be up to the whoever's giving the survey how to just decide how to log that. But normally we have things pre-categorized to a degree and allowed to open. So I would try to think if I had someone ask that question, hey, I'm fleeing abuse, is that a choice? I would expect their answer to be no, because it's not what they're like, hey, this is the lifestyle I want to live. This is something I have to do to get out of the situation.
Yeah.
But it's going to be depending on how they respond to that question.
I was wondering because the data seemed to be, the statistics seem so high on lifestyle choice that it didn't seem to coincide well with that earlier slide where there were all these different reasons that seemed like a considerable number of those would not be lifestyle choice. So I was wondering if it, within that could be, hey, I'm drinking and doing drugs, and therefore maybe they're considering that a lifestyle choice. So that's a lifestyle choice. I was just trying to kind of square those 2 things. Could that include drug addiction then?
I mean, it could. And I think when I historically have done the surveys in the past since 2018, we talk to people just in generally on when I was especially working as a sergeant with CSET, people we would ask them, we would give them these options. We talked to them about, we see them every day, right? We want to get them inside or wherever. And it's just like, no, I don't want this. This is what I want to do right now.
Yeah.
And I think when we look at our population of my estimation of our homeless in Eureka is 250 to 350, probably more towards 300. We know I've been here almost 20 years. There are people that are still on the street. And almost 20 years ago, they're still here now, and they don't want this. They refuse to take the services and they refuse to change behavior. And so it's beyond challenging to,
sure.
You can still have a relationship with them, but again, the behaviors eventually, we got to figure out a solution on it for them.
Yeah. I wanted to make sure I understood, what all was included in, lifestyle choice, because that makes it almost sound like, I just enjoy sunsets, or, it kind of sounds like, and I wanted to make sure I understood a little bit better. The other question that I had was, I think you answered with laundry, but I was curious why the bathroom and laundry needs, that data seems so much higher than a couple of years ago.
Yeah, I know our 2018 data for bathrooms, I think, was number 1 also. I don't have the exact percent. I'll pass it to Sergeant Ross here in a second. For sure, the laundry, that's the issue with the Community Resource Center no longer having funding for laundry service. But maybe you guys can shed light on the shower situation.
And can you tell me about how much the funding was that was lost for that too?
I think it was around 20,000, I believe.
Is that per year?
That was, I believe, per year, I believe.
And all of it's gone?
I believe so. I think I also sit on the board for the hospital, and I'm the chair for the Community Benefits Committee, which actually oversees that. I'm a new chair for it. So I believe somehow the funding is no longer there for that. And so that's where that was a big loss of a service.
Yeah. Okay.
the showers, it's not so much that there aren't showers available, it's the times they're available that seems to be the biggest issue we're seeing. People only get so much time, and then they can't get everybody in the same day. So the showers might be open every day, but not everybody gets a chance to use them. The problem with the bathrooms, a lot of them are closed at night, which is a double-edged sword, because if you leave them open, they get destroyed and they're closed anyways.
Yeah.
And that's something we've seen in the past. I mean, the gazebo bathrooms at night, I mean, they would get shut down for weeks on end because they would get damaged so bad. So shutting them at night leaves them open for the day, but then people don't have anywhere to go to the bathroom at night. And if you're 86 from like the shelters, then you can't go use those ones either. Sometimes they'll still let you in depending on what you got 86 for. So if like you got in a fight at the mission, you're not going to come in and use the bathroom. If you got caught smoking weed in the back, they'll probably still let you use the bathroom and then just have you leave afterwards until your time's up and so on and so forth.
Okay. Thank you.
I will say it relates to showers. Blue Angel Village, we're getting the handicap upgrade, and those will be available to the public soon.
Yeah. Thank you.
With regards to the first question too, regarding the personal choice component, we did, just in terms of our process, when we were reviewing the questions before implementing the survey, we did identify that as a potential issue. And we actually, I think, probably spent 20, 30 minutes on that question alone of that meeting, trying to figure out how do we split that hair, so to speak, and couldn't really arrive at one that didn't also have other flaws. It is on our list to continue to try and refine that one so that we can feel more confident in ruling out like the person perceiving circumstances out of their control as their personal choice, and really boiling it down. But we were unable to kind of find a unflawed way to remedy that. So, but we're going to work on it again next round. And with our admin tech, Jessica Wagner has a tremendous amount of experience in stats. And so we're hopeful that with a little more time and capability, we can actually hammer that out and address that issue next time.
Yeah. Thank you, Jacob. And sorry. But yeah, thank you. And I appreciate just the details on it. So it gave us a lot of information, even though I know nothing's going to be perfect. It's difficult to kind of get into those little nitty gritty details, but I feel like you guys really tried, and I appreciate that.
Councilmember Fernandez.
Thank you. And just for clarity on my part, when Councilmember Castellano was asking about the recovery services, it sounds like appointments were the new standard largely because of staffing and insurance. Is that okay? Yeah, I just wanted to better understand that, so thank you.
High demand, low providers.
Yeah. Okay. Going back to some of the housing elements then, you had, or demographic elements for the unhoused, you had said that the folks identifying as Native, you would try and get them affiliated with their tribe, or at least inquire with the tribe. Do we know how many are local with local tribes? Do we have an understanding of that?
It would be in my 63-page package at headquarters.
I think we had the same conversation last time, where probably some of the questions I have are going to be in that larger packet. So okay,
but we can define those out. But normally what happens is we for a while we had someone from UROC actually years ago riding with us. Actually worked with at that time Ranger Ross and Old Town Officer Ross, and actually would come down and actually try to meet their members as well. And if we do meet people, we have connections with the tribes that we just try to connect the dots, or say, hey, we don't know. We'll call up our contact and they'll help us figure it out.
And then I know you said you might not have the answer for it, but I'm curious if there's a speculation on the shelter drops where people are staying to sleep. And so is that because people are getting more into permanent or maybe some sort of transitional housing? Like, what's your perception on why there was a drop staying at shelters, or even the green belts for that matter?
I'm going to hand this over to Sergeant Ross.
Yeah.
So I think we do a lot of the surveys at Free Meal and on the street. So we didn't go into the people in the shelters didn't really want to do the surveys. It felt like this year. I went in there a few times and I couldn't get a lot of people interested. But essentially they get 86 from the shelters, and then they're done until they either work it out with the shelter, and there's only so many options. So once something bad does happen to them, they're kind of stuck on the street. And then they're sleeping. They like to sleep around Free Meal because they feel safe there. And so a lot less people are sleeping on the trail because they can sleep next to Free Meal. It's lighted. There's services there. They feel safe. People can see them. Mm-hmm. And so that's definitely a struggle. And then they don't have anywhere else to go. So they get up in the morning there and they can get food and they can get services and things like that. and you go out into the bushes of the trail, and you're kind of on your own out there. There's no lights, there's no people watching you, and so people don't feel safe, and they don't want to go in the shelters for a variety of different reasons. It seems, if my personal opinion, it seems like the drug use is the issue. If you go in there, you can't smoke weed, you can't use drugs, and they can't live the lifestyle that they want to live when they're outside of the shelter.
Okay. And that kind of goes into the next question, because when we'd gotten to the question about the needs or resources at play, a place to live was actually down from the previous. And so I'm curious if there's, again, a reason to that, which you might be able to answer to, why that number has gone down.
So there have been multiple permanent supportive housing facilities, as well as the Bayside Village, that have opened up since we did this survey last. So I don't know that would explain all of the difference that we're seeing, but I would expect that explains a significant portion of it in those changes in the data, because Bayside Village was able to pull a number of people in, especially who had been homeless for very long periods of time. The average years homeless there in the first round of bringing folks into housing was 15 years. And so that made a huge impact. But then there are also other permanent supportive housing facilities that opened up in the meantime since we did the survey last.
Okay. And then one of the issues that we'd seen that people were unhoused was evictions, and there had been that bit of an increase. And do we know the cause for the eviction? Do we know the type of eviction? No.
I would think the issue with that is with the new housing facilities opening up, people that have not gotten a chance to live inside for a very long period of time get put into a place, they don't do well, they get evicted. That can be very difficult for somebody if they've been on the streets for 20 years and we put them into housing. And so I think their first chance at getting someplace to live didn't go well. They got evicted. It is getting easier to find housing for people with the amount of places that have been opening up. So it's getting better. But I think the people were surveyed, they're on the streets today. And so they could have had a chance at housing since the last time we did a survey. Now there's so many options and it didn't go well for them.
Yeah, I think the challenge anytime we start housing folks is we've taken folks that have lived on the streets for sometimes years, right? And we put them inside of four walls and a roof and a floor, and it's different, right? It's not as free. And so, and if we don't provide that wraparound support of case management, life skill, or teaching life skills, mental health support, SED support, all these different things, it's going to fail. And we know that. We often have discussions on housing first approach and why that works and doesn't work and why it can ultimately fail, but how it's a great idea. But again, you have to have that full wraparound support. And when you don't have that, especially for folks that are moving right off the street into housing, it's likely going to fail. It is.
Right. And I think we've had that conversation.
Yeah.
I think, up here as a council, and I think we've had it one-on-one or even in small groups. And so that's an essential service too. And, again, going back to the lack of resources. Yeah, I have more questions.
Real quick.
Oh, sorry.
Because I wanted to give someone else an opportunity.
Okay, so let me get through my next two.
Real quick, Mario,
yeah.
Can I? Sorry, Councilmember Fernandez. I think one of the other things too is that with that wraparound service is it's difficult because when we work with folks to get them into housing, we see them in their current state of survival, and so they are accustomed to the way that they are living. And what we see is when we house people, they come out of that survival state, but that comes with a whole new set of symptoms, and their mental health needs often can get worse once they are housed because they've kind of been holding it together outside. But then when they have that safety component, they kind of drop, like our self-survival guards kind of drop for that, and they can decompensate inside. And then when we have the shortages and resources that we have, that unfortunately perpetuates that scenario of them being evicted.
And so then going into at least one of the last questions I have, there was also a decrease in Medi-Cal recipients and even a small decrease in food stamp recipients. And so the explanation behind that, is there one? Is it because we're seeing cuts at the federal level having an impact here, or is it just folks aren't applying like they had in the past?
I don't know that the HR1 effects will have been seen by this survey just because of the time frame that we did the survey. I would very much anticipate 2 years from now when we resurvey people, we will see effects in access to CalFresh, access to Medi-Cal, and partnership. I don't know if the decreases this round are considered like statistically significant, drops, like there's a cause to it, or if it's just a happenstance that we had a few folks drop. It's also based on self-report too. So if they like came from another county recently, or maybe they didn't fill out their paperwork because they don't have somewhere to get their mail and they didn't keep up on that, they could have been dropped recently. And so that there are multiple explanations where we could see a small dip. Next round, I would absolutely expect to see a much larger dip because of the HR1 effects.
Okay. And we did see the increase in partnership, so I think it's flip-flop. So we're seeing some come off Medi-Cal, go to partnership. So I think those numbers are kind of still in the same ballpark, but we're seeing the switch.
Thank you.
Any further questions from council? Councilmember Bauer?
First, thank you guys for all your hard work. I mean, we all appreciate it. And especially this report. Every year I sit there and it's daunting looking at the statistics and seeing what you guys have to deal with. And but I'm curious in the future, and I'm trying to think of how to phrase this question, but whether we're doing our best to get to mental health services, and are we successful? I mean, is that and maybe that's a question for you, Jacob. How is that going? Are people accepting help and getting on medication and getting on the right path?
So we still see our typical individual is in terms of mental health, right? We have our data shows that the anosognosia rate is holding steady with CARES clients, and that's even with the increasing clients that we're seeing per year. So even though we're increasing the overall clients, the percentage that end up having anosognosia, again, the symptomatic loss of insight, it has remained the same. I think that we have made headway with some clients, and then I think we have more clients pop up. And something that actually we didn't get a chance to do for this presentation, but we can certainly share out later. Again, kudos to Jessica Wagner, our admin tech. She had the great idea of pulling the raw survey data from year over year and comparing to see which names have stayed the same and which ones have not reappeared, to really analyze, like, are we seeing attrition of some sort? Are we seeing some cases resolve? Are there other cases that are remaining? We wouldn't, of course, publish the specific names for that, but we would at least be able to get an idea of, X percentage of individuals have been surveyed twice, X percentage of individuals have taken the survey all 6 times, and be able to get some new data from that.
And I think that's a hard question because our mental health numbers have gone up for culture service wise. However, our training with officers and CSET, they're they're by far in this realm, they're in Humboldt County, by far the best trained. We watched body camera foot on this. This IPA did an audit on it. They're doing very, very good work, and they're doing a very good job evaluating if it's a mental health or not. Very, very good job. Then on top of that, we pull care on top of that. And so even though our numbers are increasing, we went from 330 mental health holds in 2020 to 105 or 120 last year. I mean, a 2/3 drop because we're diverting better. But are we seeing the same people? Yeah. But then you see folks that, that were heavy hitters, we're talking 350 calls a year for service that, everyone in the city knew them. You drive by, it's like, where'd this guy go? Well, we got them assistance. And so that one individual that is very, very taxing on the community and themselves, because just the lifestyle is not good for them or anybody. So once they kind of get them assistance, I mean, for us, that's a giant win, right? You're looking for those big ones. Those aren't always going to happen. And also with Care Court, these guys have been working very, very hard with the county, getting folks to getting treatment and getting assistance. So I think it's hard to answer because we're getting more calls, but we're doing a better job, I think, on evaluating them, but also a better job on diverting them.
Yeah, you have, for sure. And that was one of my other questions, was about Care Court, how many times we've been, and that's not part of the survey, but that is an important tool that we have. I was just curious, are we using
Absolutely.
it?
So we have sent over 10 referrals at this point. I don't remember the exact number, but we've sent over 10 referrals to Care Court from our clientele with CARE and CSET. We've also streamlined the process by which the county is able to issue Welfare and Institutions Code 5200 orders, which are essentially judge-ordered 5150s at the petitioning of behavioral health. So if individuals have, say, decompensated and are incredibly sick and unable to make their care court dates because of their mental illness, behavioral health is able to petition a judge to write that order. And then that's been streamlined so that if they're in the city of Eureka, the orders go directly to CARE and CSET, and then we're able to bring most folks in within a day or two. And then they're able to get that stabilization. And what we've seen is when that happens, then after stabilization, they're able to re-engage with care court and continue their care, which has been effective. The county's done a really great job with their care court program. I think our teams have done an excellent job. I mean, Officer Clark in particular has been really aggressive with getting those fulfilled, and it's been great. I also just want to give a shout out to Humboldt in general for that. We are the only county doing 5,200 orders in the state. And so there's a lot of pioneering on that front.
Thanks. Appreciate it.
Member Contreras-Deloche?
I just had one last question, actually along the lines of what Councilmember Bauer had brought up about care court. I had seen a number of kind of negative articles written about care courts for California saying, these aren't working. But my impression that I'd gotten from you guys here directly seems to be that it has been beneficial. And I was wondering if you could speak more to our direct experience here.
Absolutely. So Humboldt County was named a Care Court champion by the governor. Humboldt County's programming and our collaboration and networking across the city and the county level and the county's other community partners has really made Humboldt County system stand out to the point where there have been other agencies from large cities such as San Diego who have reached out to try and learn more about what is being done here so that they can, try to kind of codify and re-implement it. And so there's been a lot of success. We've kind of been the exception. We exceed petitions and success rates per capita over most of the other counties in the state.
Can I ask a follow-up real quick? Do you know why we're seeing better results here in our county? I obviously we have something very unique here with our staff and the training, but I was curious why. I'm not sure if I understood fully in your answer, how we're benefiting when others are kind of failing at this, why it's succeeding here.
I think we're small enough to be able to gather consensus quickly about being creative, but large enough to have the resources to do it. And so I think that due to the level of interconnectedness with the various agencies involved and the kind of people who are in the key positions to do that networking, combined with the creativity to kind of be able to think, creativity and bandwidth to think outside the box and how we're going to do some of this stuff, such as implementing the 5,200 orders. We've been able to kind of fix some of the gaps and maybe tear down some of the silos that other counties might be facing.
Yeah, when we designed CSET back in 2018, one of the founding principles that's also located on our website is to remove barriers and red tape. We want to be outside the box. And so I think the strength of all these programs that even allows us to get this kind of data is the fact we can collaborate together. Jacob works for the city manager, but they also are in the same building together. And if there's an issue, we talk. If we need assistance from another community partner, we call them directly and we make it happen. We really try to remove red tape and bureaucracy from the process, which really fails people that are in need. That you have to go through 30 steps. That's a waste of our time. If someone wants to get into a treatment or whatever, if I can get them from point A to point Z in 15 minutes, that's a giant win. If it takes me 3 weeks, that's a fail, and that's a system fail. And so our job is to make the system better and make it work for us.
Thank you, gentlemen. Appreciate it.
Any further questions from council? I have a couple. So I was curious. I just have a couple clarification questions. The first one was, there was the slide about children, and you mentioned that they weren't little children, they were grown children. Does
Yeah.
that mean 16 to 18? What's the difference? No, tell me more about that.
It'd be 18 or older. So that's where, so you're living with if I had an adult child, if I was living on the streets or in an encampment with that adult child.
Okay. Okay, good.
But yeah, again, it's if we do find, historically, we have not found many children, and Sergeant Ross can confirm this for recent, but historically, if we have, it was very, very quick to, we even call the Director of Health and Human Services saying, hey, we're getting red tape, unacceptable. This needs to be addressed now. And it does. And so if we find those kids in the street, we have people we call in the middle of the night to fix things like that. So
I appreciate that. And then just a quick clarification about Waterfront. So I know before they were entering people in, like you were saying before, just, I see you, you're having a problem. Do you want to go to rehab? Yes, I do. Let's go. Let's do this thing. Did they have to go through detox before they went into treatment at that time? Is there a separation between detox and the treatment?
So there's a separation between detox and treatment. The reason that there's the fast track available before Drug Medi-Cal was due to the Measure Z funding and effectively beds, I don't want to say being held, but there was an avenue to get folks in faster, and there is an availability. With Drug Medi-Cal rolling out and then really going into full effect, it's allowed a lot of these rehabilitation and detox facilities to flourish in terms of being able to have full capacity or as much as their staff allows for, which is great for the program stability, because before Drug Medi-Cal, if folks didn't have enough clients, then they were not able to sustain their business, even if it was a nonprofit, right? So Drug Medi-Cal benefited these agencies in adding stability, but we also increased the demand for those beds and decrease the ability to fast track individuals in.
So is there ever fast tracking with HRC or Crossroads? Or is it mainly the fast track is through Waterfront?
HRC and Crossroads are also now on Drug Medi-Cal and have been for quite some time. And the only fast tracking that I'm aware of that occurs is usually if there is a mother who is using who is pregnant. At which point, once they're medically cleared at the hospital, then there's usually some expedition of receiving detox or rehabilitation services. But I'm not aware of any other fast tracks across any of the agencies currently.
And then, is there currently something in process to do a detox that would be similar to what, say, 14th and C used to be, that's not medically staffed? Have you heard
So
anything about
I'm
that?
not aware of any facilities coming online that are going to be a social model detox. The issue with social model detox, such as the one on C Street, was that all those folks still required a medical evaluation at the ER prior to admission. And so when we're looking at detox, the primary issue that requires medical intervention is alcohol. Alcohol, benzos, and barbiturates are the three substances that actually have fatal withdrawal states. Individuals may be incredibly uncomfortable with opiate withdrawal or with withdrawal from methamphetamines, but the alcohol, benzos, and barbiturates are actually potentially fatal. And so they always require that medical component, because if they're going to go into DTs, they need to have medical management. And the primary treatment for that is with benzodiazepines and a taper to get them through the first 10 days.
Gotcha. Okay. Thank you for that. And then lastly, I just wanted to say that I really, this survey in particular, I appreciate the way that we go about that we actually meet the individual. It's an opportunity for connection. There are too many questions, I'm just going to tell you, in my opinion. But we're able to make that connection, unlike the PIT account or the PIT count, where, I've been on that as well, where you go out and you maybe go out to Herrick and you see 3 cars and you say, oh, well, that car looks like it'll hold 4 people. So maybe, we'll count that as a 4, and maybe that one's at a 2. And there's not that personal connection. So I appreciate that we actually do make those connections and that we have names tied, even though those names aren't released. We have valid data, and I think that that's really important moving forward for folks. And then the other thing I wanted to say about that was, I heard it here tonight, when you're housed, you're not as free. And what I want to say about that is that when you have been living on the street for 30 years, 15 years, 5 years, 4 years. It is terrifying to move into housing. It is terrifying to have to learn a whole new way to live. And I just want to say that out loud because I think that, you know, we don't give people enough credit for even being willing to try to move into housing. And I really want to appreciate people that have moved forward with their life. And as you mentioned, a couple that were particularly special to me that took a long time. So thank you again for all the work you do. Appreciate you guys.
Real quick, just if I may, I want to give a huge shout out to all the staff that worked on this. This survey this year coincided with a decrease in UPLIFT's outreach worker capacity, and the resource center staff, the care staff, and CSET staff really stepped up and kind of carried things not just past the goalpost but farther. We were able to get more surveys done this year than the previous year, and that was with staffing shortages. And so I just want to give a huge shout out to the teams that put in so much effort into getting this done.
Great. Thank you so much. Nothing further? You guys are awesome. Much appreciated. So this will take us to public comment. This is the time for members of the public who wish to be heard on matters that do not appear on the agenda. City Council policy is to limit each speaker to 3 minutes. Such time allotment or portion thereof shall not be transferred to other speakers. Pursuant to the Brown Act, the City Council may not take action on an item that does not appear on the agenda. And there'll be a maximum of 30 minutes allotted to receive public comment in the initial comment period. If necessary, an additional period will be allotted to public comments after city manager reports, but only if the first 30-minute public comment period was not sufficient to allow all those who wish to speak to do so. So, thank you for lining up. Come on up. Welcome.
Good evening. My name is Kyle. Firstly, please adopt the resolution by the Humboldt Anti-War Committee to condemn attacks on Iran and Cuba. Second, I'm here with the Humboldt Tenants Union asking to build on the protections given by the Tenant Protection Act of 2019. The law itself is very strong, but there are some areas of improvement, specifically the window of time it takes to qualify, as well as prohibiting tenants living in housing that's owned by individuals as opposed to corporate landlords. The majority of units here are not corporate landlords, and so we'd like to see local tenant laws more accurately reflect the conditions here. Currently, it takes 12 months to qualify for just cause housing, which broadly limits the reasons for eviction. What the Humboldt Tenants Union would like to see is shortening that window from 12 months to 6 months. For example, a local tenant was recently served a 30-day notice after their building sold to a new landlord. They've been living in the same property for 2 years, but because they switched to a different unit and signed a new lease, the Tenant Protection Act has a gray area where they could be forced to move, even though they've been living in the same building for almost 3 years. And more broadly, we are asking to require 90 days to vacate as opposed to a 30-day. As you can imagine, with the current housing situation, it is very difficult to find housing within 30 days. I'm glad that some data on homelessness was shared tonight, because I'd like to note that 15% of those living on the street are left there due to evictions and loss of housing. Most of our tenant work is made up of no-cause 30-day evictions. If we had stronger protections, according to EPD's own data, more than 30 people wouldn't be living on the street. Yeah, thank you for your time.
Thank you. Welcome, Pat.
I'm also a member of Humboldt Anti-War Committee, and I also wanted to say that we really need to have a resolution for this city for no war with Iran and no war with Cuba, no more forever wars. And I guess I don't know whether I need to explain why we shouldn't have these wars, but I will. And I'll say we shouldn't have one of the Iran never invaded us to begin with, and Iran never had any nuclear weapons. They did try to get nuclear power and enrich, but they didn't have any weapons. And Cuba never invaded us either. I would also like to say that although Trump is the most blatant bastard. All the other presidents and practically the whole history of our country was very warlike. And we've got to stop these wars. And you're probably going to say to me, well, why should we have this? I mean, it's just the little city of Eureka. It's just a bunch of propaganda. But it's not. It's actually, we have to get together. We will be like, we will show the other cities in this country that they can stand up also to the federal government and say, we don't want this. And it's just, I just want to say no more wars. Thank you very much.
Thanks, Pat. Hey there, welcome. Give me a second.
Yeah.
There you go.
Hello, I'm Ryan Littleton. I'm also. Oh.
You're very tall.
Yeah, no problem. Thank you. I appreciate it. Yeah. So where was it? Oh yeah, I'm Ryan Littleton. I'm with the Humboldt Anti-War Committee. We're here because we believe that Eureka, the Eureka City Council should be, as you know, a governing force of Eureka, should stand out and say that we do not want any U.S. war with Iran or human rights violations towards Cuba with the cruel blockade that has been going on since, I believe, 1961, whenever. Yeah, it's been a long time. And also with the Trump's escalations on the blockade, with the blockade of fuel and essential stuff for people to live. So yeah, I hope you adopt our resolutions. I have it right here, and I'll be happy to pass it out. And hopefully we can work on making this quick and easy. So yeah.
Thank you. Come on. Sorry. It's coming down. There you go. Welcome.
Thank you. I'm Elizabeth Haynes, and I'm here to tell you about AAUW Humboldt, an organization that I'm in. My colleague, Chris will follow up with why we're really here. I'm going to tell you about us. She's going to tell you what we want. So as I said, I'm Elizabeth Haynes. I'm a member of AAUW Humboldt. We have a membership through much of Humboldt County with members in Trinidad, Blue Lake, Hydesville, and Fortuna, as well as Arcata, McKinleyville, and Eureka. AAUW is a national organization. It's the American Association of University Women. We've been advancing equity since 1881. Nationally, we give out over $6 million in scholarships and fellowships annually. Our Legal Action Fund has supported women in Title IX lawsuits, sexual harassment and abuse cases, and pay equity cases. We helped fund the Lilly Ledbetter's case and fought for the 2009 Lilly Ledbetter Fair Pay Act. And we've been working to close the pay gap since 1913, when a Washington, D.C. branch published a study that showed that women civil servants at that time made 78 cents for every dollar that male civil servants made. While that picture isn't much better now, today on average, women make 81 cents on the dollar for males. And if you break it down by race, it's much worse. The Native Americans and Hispanic women make only 58 cents on the dollar for a white male, and white women only make 77 cents. So locally, what do we do? Well, we're promoting education, because there's no better predictor of a well-paying job than a good education. In Eureka, we offer a STEM education program to middle school girls, and because we know that STEM education in middle school and high school opens possibilities for young women. The program that we offer is we send 5 girls from middle school in Eureka to a summer camp Tech Trek program at CSU Sonoma, where they participate in hands-on STEM activities. We give high school Chromebooks to students in high schools who are going through a non-traditional program. We have scholarships, and we have a Women's History Tea each March. This year we honored Dr. Anna Nusslock and Maggie Peters. And Chris is going to come up and talk to you now. Thank you.
Thanks for being here. Hello and welcome.
Good evening. I hope you can hear me.
We can.
Is that right?
Yeah.
Okay. Good evening. I'm Chris Will, a Public Policy Director for AAUW Humboldt. Every spring, the American Association of University Women of California works with our state legislature to co-sponsor bills for the yearly legislative agenda. This year, they co-sponsored 2 bills focused on human trafficking, education, and protections for youth, and a 3rd bill that prohibits health plans or health insurance providers from denying coverage, benefits, or limited health care services to a person based on race, color, national origin, age, disability, or sex. Nonpartisan advocacy for laws and policies to ensure equity and end discrimination is what we do. The California legislature is strengthening protections against discrimination at the state level, as the federal government has abandoned diversity, equity, inclusion, and other anti-discrimination policies. So we are here to focus our advocacy on local anti-discrimination education and protections. SB 1340, a state anti-discrimination law, was enacted in January of 2025. AAUW California launched a project called City Council Action and Monitoring. It is a project to focus on local activism because small local activism actions often have a ripple effect. My understanding is that this law permits city governments to enact and enforce local laws prohibiting discrimination. Our goal is not so much to monitor local action on SB 1340, but to build relationships with the City Council, to identify areas of local discrimination, and to collaborate with you on new policies that comply with state law. Our AAUW Humboldt Humboldt project team would like to meet with one of you council members to discuss SB 1340 and help to enact local anti-discrimination policy if and where it is needed. I have copies of my request here for each member of the council and also my contact information. So thank you.
Great. Thank you.
Good afternoon.
Hello. Welcome.
Thank you. My name is Big Lou from the Eureka Sunshine Ordinance Task Force, and we're here to shed light on the workings of Eureka, simply because light threatens darkness, and we all know darkness serves nothing, and light is the way forward. So, we see violations, and we bring them to you, and we have an order of determination whether it's a violation. And if we find a violation, there's an appeal process. You can appeal the order of determination, and you can appeal it to the Ethics Committee. Is it ethical or not for this ordinance to go forward, and has the public been given due notice? Unlike the recent meeting over there, the Board of Supervisors, about the Sheriff's Oversight Committee where the doors were locked. It's a classic example of the public being denied input for something that's crucial for the goings-on of government. Correct? So, that's what we intend to bring to Eureka government. It is a startling difference between other jurisdictions where they have a sunshine ordinance and Eureka doesn't. So once we bring stuff to light, we'll start to realize that maybe the colonists weren't such bad people like you portray them to be. Savages, colonists. Flip that script to where the colonists are the savages and the savages were somehow superior in this domain, and apparently the white man just treated them real badly, and we need to constantly remind everybody at every point in time that fact. It's just so disgusting to start a meeting off with that negative context, and it really shows where you're at. Thank you.
Thank you. Big Lou, we did have a clarification at the Bike Month thing, and I asked you to email me, and I would send you a copy of that sunshine ordinance. I have not seen your email, so please email me. We'll get that right to you.
I did send
Thank
you
you
an-
so much. I'm not going to argue. We'll talk after.
Okay.
Is there anyone on Zoom? Oh, I'm sorry. Is there anyone else in chambers that'd like to comment on public comment? Seeing no one. Do you see anyone on Zoom?
I see no one on Zoom.
So we will close the public comment then and bring it to council reports, and we will begin with Councilmember Castellano.
Okay. I attended the Humboldt Transit Authority meeting, and I also attended a cookout in honor of the retirement of Greg Pratt, who has served at Humboldt Transit Authority for more than 2 decades, and just want to thank him for his service to transit and to the local community, and also welcome Katie Collender as the new director for Humboldt Transit Authority. I attended the Eureka Main Street Spring Festival, where I beautified about 8 dumpsters, and thanks to Recology, or along with a bunch of community members, but thanks to Recology and the Eureka Cultural Arts District and Eureka Main Street for supporting that. Those will be kind of part of just a larger side project to beautify Opera Alley. They're going to get, Recology has to take them back, put some stickers on them, and then they're going to place them in Opera Alley sometime in the next week or so. I went on a ride along with Eureka Police Department officers Clark and Shaw, and just want to thank both of them for their time and for their dedication to the community. It was really, they're just both very thoughtful, very generous in their time with me. And I attended the Humboldt Waste Management Authority board meeting, and I also attended Congressman Huffman's event at the Bayside Grange.
Thank you. Councilmember Moulton?
Thank you, Mayor. I have no travel to report. I do want to take this opportunity to say that calling the indigenous people of Humboldt savages is a dehumanizing slur that has no place in civic discourse. On to my report. I attended the Humboldt Bay Fire board meeting, as well as the personnel committee. I attended the Transparency Humboldt Coalition Blood on the Clock Tower event, which was sort of a liar's game, including some politicians and some actors. It's very entertaining, a little weird. I attended it's great. I attended lying like on purpose. I don't know. I'm not very good at it, but I did win. Okay. Attended the planning commission meeting. I got to go off council stuff. I got to go to the Rutabaga Ball, which is a benefit for Kinetic Universe, the nonprofit that runs a Kinetic Grand Championship. If you aren't aware, that big, amazing event is run by a local nonprofit. The ball was a benefit for the Universe as well as the Eureka Theater. All hail and glory to Rutabaga Queen 2026 Gustav Waddlesworth III. She is a very silly goose. I'm looking forward to the Kinetic Grand Championship, Humboldt's oldest and geographically largest free public art event. It's all free and all over the county. Go to kineticgrandchampionship.com for a spectator's guide and go check out our amazing backyard and our amazing neighbors and their amazing art. It's really fun. That's all.
Thank you. Councilmember Fernandez.
I too participated in the Blood on the Clock Tower event. Unfortunately, Team Evil won that night, even though it's usually not, easy dichotomy of life being good and bad. But in this one, there was a clear division. But again, fun at least fun was had in that scenario. As I had also attended Congressman Huffman's, I think it was Hootenanny, was it? Yeah. Yeah, just this last weekend. So it was good to hear him speak along with County Supervisor Mike Wilson. And that's all I have, at least for council business. And much like Councilmember Moulton, I too take some umbrage with earlier public comment, and any inference of race from our land acknowledgement ought to look to some sort of inward psychology on what's going on there.
Thank you. Councilmember Bauer.
Thank you, Mayor. I attended Humboldt County City 2x2. We had a Humboldt Bay Fire meeting just recently as well. I missed Quarters for Carson, and I had a 50th birthday party to go to, so I couldn't miss that. But I hope it went well. I'm sure some of you were there. I attended the Born to Breathe award ceremony. A bunch of our local high school students doing really cool art about the dangers of smoking. And I also attended the Huffman Hootenanny, and it was a great experience to see our congressman and hear what's going on. And I think that's it for me. Thanks.
Thank you. Councilmember Contreras Deloche.
Yeah, thank you, Mayor. I actually did something I haven't done in a while. I took a 1-week vacation. I know. But I did, like I said, I got to speak at one of the National Day of Prayer. I talked about unity in the community. A call for unity in the community was kind of my theme. I got to go to the recent Humboldt Democrats meeting. I got to listen to Assemblyman Chris Rogers speak, as well as Congressman Huffman. And went to a housing meeting. I also attended the Board of Supervisors 2x2. And then I bounced and went down to Davis and got to see a Miles Davis tribute band and got to enjoy some jazz. So that was my little vacation I got to do. That's my report.
Thank you. And let's see, I've been out a little bit myself. So let me just take a peek here. So I too went to the Born to Breathe Youth Media Festival, and Councilmember Bauer and I believe she's Councilmember Atkins Salazar from Arcata were judges, as well as myself. And it was really neat to see these kids. I had a former student that was there as well, and it was just really great to check in and see the wealth of talent in our youth and our community. True blessing. I emceed the Humboldt Literary Project Out Fox Trivia Contest and was able to sing a happy birthday with the whole crowd to the lovely Councilmember Moulton. Our town hall was May 9th. It was incredible. We had 60 people there, Jessica had counted. I want to thank Jacob and Laura, the NAMI, CIT, DHHS, Redwood Regional Center for providing translation. It was an incredible opportunity. It will be on video available hopefully this week, if not next week. So that was a real winner. And Casaro did a great job on the catering. I attended the Boys and Girls Club 29th Enchanted Evening Champions for Youth, where I got to see Michelle Constantine, Board Member of the Year. Leroy Zerlang, Ambassador of the Year. Business of the Year was Coast Central. They were also the Business of the Year at CASA. And Individual of the Year, Kay Johnson. Volunteer of the Year, Carlos Sanchez. And I say those names because they're important. These are incredible community members that are giving back. And I know that there are many that don't get named, but I just want to name them in the moment. I did the Habit Burger ribbon cutting, which was a lot of fun. I went to Bike Month Jefferson, and I'm telling you what, it was blowing a gale. Riding my bike down there, oh my God, it was so miserable. But once I got there, it was super fun. We rode that little bike to make sure that there was music allowed or going. Let's see, I did that. And then I went to the Eureka Heritage Society Preservation Awards, where the Westside Community Improvement Association was honored. They had this great video. I want to show it at council sometime about their process and how they came through. Scott and Stephanie Phelps were recognized for their restoration of a 1907 colonial revival house. And guess what, you guys? The city of Eureka, that's right, and Sequoia Park Zoo were awarded as well for the conservation of the Robert Usher Foundation and Ferry House. And Pete Johnston was Preservationist of the Year. He's a local contractor that does a lot of work in our region. So I've been a little bit busy. Oh, and then, of course, I attended Quarters for Carson Park. And, you know, it's always fun hanging out with Team Eureka. But it was so cool. I didn't win anything. And so at the end, this little boy, he was probably, I don't know, 5th grade. He'd won this mirror in the raffle. And he says, I'm going to get rid of this. He goes, do you want it? And I was like, yeah, I'll take that. It's a nice big mirror this kid gave me. What a sweetheart, right? See, again, our youth doing great things in our community. I was very grateful. Yeah, and then I got a painting too. So it is always a great opportunity to hang out with community. I love it. And I do have to say, I did attend the Rutabaga Ball. Always so much fun. Again, we had one of our council members was a judge. Guess which one? And I wanted to announce also that Crown Princess Jillian Justress and Glory Hug Princess Mother of Pearl were both winners. Jillian Justress is a young girl. She's like 17. Best energy, you guys. She was just incredible and just such talented women. And so I hope that you all will join us out at Kinetics this weekend. It's going to be fabulous. It's going to be glorious. You're going to have a great time. You're going to see everybody you know. And it's such a community treasure. So I guess that's it. We'll move on to consent calendar. Thank you for listening. All matters listed under this category are considered to be routine by the City Council and will be enacted by one motion. Pursuant to City Council Resolution 2011-22, if a member of the public would like an item on the consent calendar pulled and discussed separately, the request shall be made to a council member prior to the meeting. Unless a specific request is made by a council member, the consent calendar will not be read, and there will be no separate discussion of these items. No one's mentioned anything to me yet. Does anybody have anything? Okay, great. So with that, if we could get a motion in a second.
I'll move we approve the consent calendar as written.
Second.
Motion is second. Please vote.
5 yes votes, motion carries.
Thank you. This brings us to legislative action correspondence. Looking to my left and right, nothing. This brings us to our ordinances and resolutions. This is a special one tonight. The Devoyne Flatmo Alley naming with Staff Senior Planner Lofner. And I want to first turn it over to Councilmember Moulton to say a few words about this great thing that is happening for our community.
Am I going to go first?
Yes.
I have a little slideshow.
Oh.
Do I have a little slideshow? Oz? Oh, took him by surprise.
Do you have it?
Was it at the, it didn't make it into the folder.
It didn't make it to the folder. A technical moment, friends. Give us 1 minute here. Or 3.
Sorry about that. He's got it. Just take a second. To make this less complicated, Oz, I will just ask you to go to the next flag, or I'll ask you to advance my slides if you don't mind. We lost it. There he is. Dwayne Flatmo. Artist Dwayne Flatmo is a Eureka icon. Next slide. He's got it. His work can be seen in every corner of our community, from the 6-storied dancer overlooking the city of town, the center of town, to his memorable kinetic sculptures floating, or sometimes not floating, across the Humboldt Bay, to local product and event artwork you can find in most of our closets, refrigerators, and garden sheds. Next slide. Flatmo's style is as unique and recognizable as the man himself. It has become a part of the landscape, part of the local vibe. It's a little gritty and pretty weird, but playful and approachable, like Dwayne. Next slide. In my proposal, I laid out many ways Dwayne's work has shaped our community, how he's inspired a generation of local artists and represented Eureka across our country and even on the world stage. And I want to point out here in the bottom left is with a machine that Dwayne brought to the Strange Vehicle Games in China, an international competition. On the top right is the Tin Pan Dragon sitting in the Smithsonian. The only kinetic sculpture to ever be shown in the Smithsonian. On the bottom right is El Pulpo Mecanico, which the first year it went out to Burning Man made such an impact that it has become an icon for the event itself. And it has been used to represent Burning Man in art all over the world. And right there in the middle is my very first kinetic sculpture team, Dwayne on the right, and that's me on the left with the pigtails. We were riding a 900-pound lobster. Next slide. Dwayne Flatmo has left his mark on this city, and I believe we should claim him as the local treasure he is officially and put his name on something in the heart of Eureka. So on behalf of Dwayne's wife, Mickey, everyone who has ever counted him as a mentor, including myself, and everyone in our community whose favorite hoodie has a Flatmo on it, I propose that the city of Eureka name the alley between F Street and G Street, between 4th Street and 5th Street, to Dwayne Flatmo Alley. And now the planners have some official things to say about it. Thank you.
Thank you. Good evening, Mayor, Council members. My name is Chris Lohefner, here to present the Dwayne Flatmo Alley naming project. The city's Community Services Department received a proposal from Eureka City Council member Moulton for a Eureka Alley to be named Dwayne Flatmo Alley. The alley proposed for naming is located on the north side of Eureka between 4th and 5th Streets and F and G Streets, 1 block east of Charlie Moon Way, which is on the same alley corridor but between E and F Streets. Along the north side of the alley is the Arkley Center for the Performing Arts and a parking lot for Redwood Capital Bank. On the south side are a couple of commercial storefronts facing 5th Street, as well as the future home of the Ink People. Worth noting is that there are 2 of Flatmo's murals along this alley corridor, one of his most recognizable works, a tribute to architecture and performing arts, as well as the Alley Cats mural. Eureka Municipal Code 152.15 prescribes a process for naming and renaming of streets and other public facilities, a sequential process through various commissions before a final decision at City Council. The Open Space, Parks, and Recreation Commission received a report and recommended the naming of the alley at their meeting on March 26th of this year. The Planning Commission then reviewed that recommendation and the proposal at their meeting on the 13th of May. After brief comments from Councilmember Moulton, the Commission acknowledged the one public comment that was received prior to the meeting, which objected to naming any public space or building after a living person. The Commission then voted unanimously to also recommend naming of the alley. And following the Planning Commission's action, the Council may now make a final decision on the alley naming proposal or remand the matter back to the Planning Commission for further consideration. Certain findings must be made to approve the alley naming, which include the alley proposed as Dwayne Flatmo Alley is not a continuation of or approximately the continuation of any existing street or alley. There are no other streets, alleys, or public facilities in Eureka named Dwayne Flatmo Alley, so there should be no confusion with other streets, alleys, or public facilities. Naming the alley Dwayne Flatmo Alley, along with the wayfinding signage that will be installed, references Dwayne Flatmo's contributions to Eureka's cultural life and visual identity, and his mentorship of local youth and artists through community-based public art. And finally, alley naming is not considered a project under CEQA guidelines and is therefore exempt. Staff included a draft resolution with the agenda packet, and council was sent a supplemental notice prior to tonight's meeting, which included a revised resolution to reflect the Planning Commission's endorsement last week, as well as a spelling error correction. And based on the staff report analysis and findings consistent with zoning standards, staff recommends you accept public comment and adopt a resolution to approve naming the alley as Dwayne Flatmo Alley. And I have a suggested motion when you're ready.
Great. So do we have any questions from council? Great. We're going to open this item up to public comment. Is there anyone in chambers that would like to comment on this item? Come on up. Welcome.
I'm a Hakeem. I've only lived in Eureka for around a year, a little more. So I don't have strong emotional attachments yet, but this sounds pretty cool. I might have feelings if it doesn't happen.
Thank you, Hakeem. Do you see anybody on Zoom?
I see no one on Zoom.
Okay, seeing no one, we will close the public comment and bring it back to council for comment, or actually for a motion, a second, and then comments. Councilmember Moulton.
Can I see that? So there you go. I move the City Council adopt a resolution finding the project exempt from CEQA and naming the alley bound by 4th and 5th Streets and F and G Streets as Dwayne Flatmo Alley.
Second.
So we have a motion and a second. Are there any comments? Councilmember Castellano.
Thank you, Councilmember Moulton, for bringing this forward and honoring Dwayne in this way. He's definitely, made a huge impact on our community, and it's going to be, just another sweet moment, of Dwayne-ness. And perhaps one day, we confuse the issue and have Dwayne Flatmo Road also, who knows, but excited for Dwayne Flatmo Alley.
Thank you. Any other comments? I too want to thank you for bringing this forward. Eureka's art rich, and he is like the epic icon of that locally, and so big appreciation. Please vote.
5 yes votes, motion carries.
Great. And we're going to take a short break, and we'll be back in 5 to 7.
Drilling. At the previous meeting, staff discussed the conflict between passing a local ordinance and our local coastal program, and how an ordinance wouldn't be an effective way of preventing those uses. And so council requested that staff bring back a resolution in opposition of offshore oil drilling off our coast, as well as mining. And so staff reached out to the county. The county had passed an ordinance in opposition of similar, so staff amended that ordinance and it is in front of you tonight for consideration. And so staff is recommending the adoption of this resolution. Excuse me.
Great. Do we have any any questions for City Manager Slattery? Councilmember Bauer?
Just clarify, I wasn't here at the last meeting, so you said that the county has an ordinance, or you mean
No,
a resolution?
No, a resolution I meant to say, yeah.
Yeah, and maybe just to
So
help me
recap of what the issue is our current zoning code in the local coastal program has a zoning designation of coastal dependent industrial. That use of energy related uses is principally permitted under that local coastal program. If we were to pass an ordinance locally, it wouldn't usurp or trump the local coastal program. So in order to make that effective, we need to incorporate those changes that would prohibit those energy related uses as being principally permitted through our local coastal program update. So council directed staff to pursue those changes as a part of the local coastal program update, and then in the interim look at this resolution.
Perfect. Thank you.
Okay. Seeing no further questions, we will open this item up to public comment. Is there anyone from the public who would like to speak on this item? Come forward, please. Welcome back.
Thank you very much. And great to have alternative energy sources, but ultimately you can't create energy. You can only transfer it from one source to another. And I've looked and researched into these offshore wind projects, and I think it's a lot of virtue signaling, basically.
So this item, just so you know, we're talking right now about drilling, oil drilling. We're not talking about wind energy. Wind energy is not on the table right now. We're talking about drilling off the coast.
Right, but
So we want to speak to whatever this item is.
Isn't the wind
discussing.
energy in place of drilling?
No.
No?
No, it has nothing to do with this. Nothing.
Okay, well, I just wanted to say that, we're all having a real hard time with gas prices and energy. And I feel like this gas tax and all the extra fees that are going to these projects like the rail and the Green New scam is really putting a crimp on working folks trying to survive here. And so, it doesn't look like it's working out. And these projects, like the oil drilling, need to go forward because we need cheaper fuel. And I don't think an alternative wind energy source is the panacea that everybody's looking at that's going to be greener and so forth. Tearing up the harbor and so forth and displacing the oysters is not a way forward. So, yeah, we've got to do what we have to do right now, which is lower the price of gasoline for everyday residents in Eureka so that homeless people will be able to get jobs because people have more disposable income to pay them to come take care of maybe their horses or do something that they could do. Homeless people can do a lot of things, and you see that in different third world countries. They do everything. It's only regulation and procedures like ridiculous drug tests to do simple, mundane jobs that prohibit homeless people from getting back into the economy. And that's what needs to change is places where homeless people can interact rather than being in a building and an office being in consumerism. But back in the old days, we had a racetrack. We had lots of ways where people that were down on their luck could actually get back into the job place. And systematically over the years, you've taken that away by closing those facilities and reducing the amount of animal interactions that people have. And that causes disease, because you get disease stuck at home if you're not involved in the procession of life, like I'm trying to be here. Thank you.
Thank you. All right, is there anyone else? Come on up, Hakeem. Hi.
I think for me the main concern with oil is when there's an industrial accident, the government will be quick to cite numbers about how much it's going to cost to clean up. So in my mathematics for ecosystems, I try to look not just at the positive estimate for any given market, but the negative estimate in case things go wrong.
Thank you. Anyone else in chambers? Seeing no one, we will move over to Zoom, and I do see a couple up there. Go ahead.
Jen?
Hi, everyone. Jen Colt with Humboldt Waterkeeper. I am here to strongly support the approval of this resolution. And thank you all very much for directing staff to bring it back and include offshore mining as well. Certainly, I really wish the Eureka City Council had control over gas prices, but I know you don't. And we know that offshore oil drilling would be devastating to our coast. We have seen it time and time again. And, you know, we all wish that we didn't have to fight this again, but hopefully this will be a process going forward where it's removed from the LCP, the Local Coastal Program, as a principally permitted use once and for all. And we support that effort as well. So thank you all so much for protecting our coast and our bay.
Thank you, Jen.
Marissa?
Hello.
Go ahead.
Hi, my name is Marissa. I'm a environmental engineer. I went to school here at Cal Poly Humboldt about 10 years ago. I work in the energy industry, and I live back here now. And I'd like to also support the council in adopting the resolution to oppose any new or existing offshore oil and gas from the significant environmental damage and habitat destruction that could happen. I know that we're under a lot of pressure for energy costs, but doing more drilling is not the long-term sustainable solution that prioritizes the health of our ecosystem and our community. So yeah, thank you to the council.
Thanks for being here. Do you see anyone else?
I see no one else.
So we will close public comment, bring it back to council for a motion, second, and conversation. Councilmember Bauer.
Yeah, I'll make a motion to adopt the resolution of the City Council opposing new and existing offshore oil and gas drilling and deep seabed mining.
Second.
We have a motion and a second. Are there any comments? Seeing none, please vote.
5 yes votes, motion carries.
Thanks, everyone. Future agenda items. Okay, wow. Seeing none, we'll move to city manager reports. City Manager Slattery.
Thank you, Mayor, and good evening, Mayor and Council once again. Just have a couple of quick items I want to update Council on. One is our housing element. We recently brought forward to Council a draft request for proposals to go out and seek assistance in putting together our next cycle housing element. Our current housing element ends in 2027, and we need to start preparing for the next cycle. We've had a couple of agenda items related to our regional housing needs allocation and other items similar to that, and this will be the next step in the process to get our next cycle for the housing element going. And so we received proposals back. We have received 2 of them. We'll be coming back to council with a recommendation for one of those consultants to help us through the process. As far as the timeline is concerned, we're looking at developing a draft by August of this year. So we will be pushing really hard between now and then with a lot of public outreach to develop a site inventory and other components of the housing element. And so stay tuned for more on that. And then the other item I want to present on is the Community Stewards Program. And Oz, there should be a link to a video in a PDF there. Oh, there he is. Oz is on top of it. So you can start it.
There we go.
Should help.
We meet on Friday and always plan to leave from the Warfinger building and head south towards Bayside Village down at the foot of Hilfiger, or we can go north. And it's just a really awesome way to be connected to the trails, to the people who use the trails. And if we see any messes, we'll clean them up or we'll call them in if they're too big. But it's just a really great way to enjoy this amazing area we live in and this trail, and to just be a pleasant presence.
Thank you so much for coming in.
So we're trying to recruit more stewards for our program. I want to thank our wonderful actors and community stewards, the infamous Q, Scott Q. Marcus, Omar Abi, Chris Bolle, and Kimberly Kiesling. Obviously, the mission of the Uplift Stewards Program is to promote goodwill and hospitality throughout Eureka. We most recently have started the bike program for folks. Thanks to EPD, we utilize some of the bikes that they have in their evidence room, and we give those to our stewards, and they go out and go up and down the trail and help out with some minor maintenance, but mostly there to provide hospitality. And so right now we're really concentrating on that and trying to get more participation along the waterfront trail, especially now that summer's coming on. So if anybody's interested, they can send an email to uplift@eurekaca.gov, and we can get you all set up. You can also bring your own bike if you want to, but we have a bike available for you if you're interested. That's all I got.
Do we have any questions for City Manager Slattery? Okay, seeing none. Thank you all for coming. We appreciate you being here. We're adjourned.